Imagine going to the hospital with a high fever and leaving with a $7,000 bill, even if you have insurance. This isn't a rare case. This is the American healthcare system. In today's video, we break down exactly how working-class Americans, even those with jobs, insurance, and families, are going broke just trying to stay alive. Let's talk about the numbers. 66% of all bankruptcies in the United States are tied to medical debt. Over 100 million Americans currently have some form of healthcare-related debt. And nearly 1 in 5 adults has delayed or skipped care due to cost, even for life-threatening conditions. The system isn't just expensive, it's predatory. Private insurance plans often deny essential procedures. Out-of-network emergency visits leave patients with thousands in bills they never agreed to. Even simple diagnostic tests can cost 10x more than in other countries. Take Sarah. She had pneumonia, went to the ER, stayed one night. She was insured, but her deductible was $6,000. Now she's on a payment plan of $400 per month for the next 2 years. That's not healthcare. That's a trap. Or James. He got into a car accident. The ambulance took him to the nearest hospital. It was out of network. He got a $17,000 bill just for the ambulance ride and which his insurance refused to cover. He didn't choose the hospital. But he has to pay anyway. And it's not just emergencies. People with chronic conditions like diabetes or asthma pay hundreds every month just to survive. Insulin prices in the US are 10x higher than in many other countries. Even with the Affordable Care Act, millions fall into the coverage gap. They earn too much for Medicaid but too little for subsidies. These are waitresses, truck drivers, retail workers, the backbone of the economy, and they're drowning in debt. What are the solutions? Some states have expanded Medicaid. Nonprofit hospitals can forgive some medical debt, but most people don't know how to apply. Organizations like RIP Medical Debt are buying up debt and canceling it, one family at a time. And some employers are beginning to offer better coverage, but it's rare. But let's be honest, these are band-aids on a bleeding wound. The real change needs to be systemic. Universal health care. Price transparency. Accountability for insurers. And public pressure, from people like you, to make this crisis visible. So what can you do? Pushpin know your rights. Pushpin always ask for itemized bills. Pushpin negotiate. Hospitals often reduce balances if you ask. Pushpin support legislation that expands coverage. Pushpin and most of all, speak up. Because silence is how they win. And every story we tell is another step toward change. If you've ever been crushed by a medical bill, this channel is for you. Share this video, comment your story. Subscribe to stay informed, and let's fight for health justice together.